So to start off about the first question, as far as performing OT evaluations and developing client-centered interventions, I haven't had much experience, if any, with this population. So I did find an article titled Occupational Therapy in the Care of Individuals with Spinal Cord Injuries, and it discusses using different standardized assessments, specifically the FIM scale, to gain insight of a client's occupational performance level. And then through our textbook, talking about an occupational therapy evaluation with a spinal cord patient, the OT will need to be able to complete an occupational profile, recognize the patient's psychosocial status, including what motivates the client, what their personal goals are, and the resources that are available to them if they have family support or people who can help them in their home environment. Their body functions and structures, specifically what sensory, strength, range of motion is intact, and their functional status as far as their ADLs, if they're able to complete their self-care activities or tasks. So taking all of those things into account, the OT can develop a client-centered, holistic intervention plan to address those deficits and promote independence. What knowledge do I currently have? So I work with in a pediatric outpatient clinic, as most of y'all know. So, and then my other experience has been in the school system, and I really have no experience in an occupational therapy setting working with patients with spinal cord injuries. I did when I was a support associate or HAP tech. I worked one-on-one very briefly with a young man who had a spinal cord injury when he was 15. He did a flip on a trampoline, and when he landed, his neck hit the edge, the metal part of the trampoline. And so I worked with him some, just providing assistance in his home with his some of his ADLs, some IADLs, meal prep. He required assistance for his bowel and bladder program, showering, did some transfers. He used a slide board most of the time, I think, to get in and out of bed. He had a hospital bed in his home, and so I did a little bit of that, but it wasn't really from an occupational therapy standpoint. It was more of just helping him do those things. So most of my knowledge of spinal cord injuries have come from school and our textbook and doing our on-campus simulations. So things such as learning the levels of injury, if it's a complete, incomplete, and then the various syndromes that can come along with it, so like central cord syndrome and the anterior spinal cord syndrome. As OT practitioners, it is important to understand these different diagnoses and their prognosis, what is affected, what can they have functional capabilities. Sorry, my cat is going a little crazy. So understanding their functional abilities and their impairments is important to form those client-centered interventions and their plans. I'm also familiar with the possible complications that may accompany spinal cord injuries, including the neurogenic bowel and bladder, which causes the interruptions between the nerves in the spinal cord Pressure ulcers, of course, are important for us to know about. They're a common complication with people with spinal cord injuries, and knowing when to, or for us to teach the patient, knowing when to do pressure relief is important, so we can educate them from developing those or preventing those. The autonomic dysreflexia, which of course is the life-threatening condition that can accompany a spinal cord injury. It's important to know the signs and symptoms of those, educate the patients of knowing the signs and symptoms so that they can get immediate care. And then the spasticity, which can cause a loss of the range of motion, can also cause pain, so it may not only disrupt their ADLs from a functional standpoint, but may also decrease their quality of life if they have that. So providing orthotics and exercises, range of motion exercises and stretches, knowing when to fit them for an orthotic is important. What knowledge do I need to develop? Overall, just a basic, just the basic knowledge for, working with these types of individuals. Again, like, I don't have any experience really working with them, so just knowing, kind of having a foundation is important, knowing standardized assessments, more knowledge of the ASIA scale. We've touched on it, and that's helped. The dermatomes and specific interventions that have evidence that providing evidence-based interventions. Also knowing when to work on restoring function and when providing modifications or adaptive equipment for individuals who have an incomplete injury. I know that's a gray area, so knowing when to transition from restoring function to more of a adaptation. What practice skills do I need to develop? Again, I feel like I could use practice in all of the areas, so handling, transfers. We've done slide board transfers, and I feel pretty confident in that. Knowing how to, I guess, assess if they're able to do a transfer, so working on like upper body strength, knowing what they need as far as to complete the transfer successfully. More experience with handling. Of course, we have experience with the Hoyer lifts, but more skills in transfers overall would be great. Medical management is another area I would need more practice in. It. Medication management would be important, again, as well as the prevention of pressure sores and managing those from a medical standpoint. Orthotic management will be important to learn about as far as the appropriate types of orthotics and what is best for the patient and their conditions to prevent secondary injuries and maintain as much function as possible. As far as resources, AOTA has a great, just kind of brief overview. The title of it is Occupational Therapy and the Care of Individuals with a Spinal Cord Injury, and just gives a brief overview of spinal cord injuries in general, but then also occupational therapy's role in facilitating participation in meaningful activities. Just a bunch of different ways that we can address this diagnosis and ways we can help the patient. Also, I found on the American Association of Neurological Surgeons, they have a lot of information on spinal cord injuries, the different syndromes, just from a clinical standpoint, but also from a functional, kind of more OT-based, I guess, standpoint. And then on Hopkins Medicine, Johns Hopkins, they break down spinal cord injuries, the different levels with the possible impairments and the rehabilitation potential for each level, which I thought was very helpful. And the Shepherd Center also has some really great information on spinal cord injuries. And lastly, I found this great resource on, it's called Client-Centered Practice in Spinal Cord Injury Rehabilitation, a field guide, and it goes through some case studies and some strategies that are just good to read and know how to approach the clients who have these injuries from a client-centered standpoint. So some of them are were kind of common sense, but then some of them were things I hadn't really thought about. So it was just a good resource. And that